someone who's suffering from chronic constipation? Yes, this is an issue which is very often less talked about because we're ashamed of talking about it. But I'm here. My name is Simran and I'm a clinical nutritionist by profession, and today I'm going to help you resolve your issue of constipation forever. So it's very important to understand if you are constipated or not. So for that I will upload a chart right here, and you can just identify your stool and understand if you are constipated or not. Second, I'm going to explain you some reasons why do we get constipated at all. So there are four major reasons of getting constipated. First is lack of fiber in your diet. Second is lack of lubricants in your diet. Third is lack of water in your diet. And fourth, when your peripheral muscles are stiff. So let's talk about these issues and understand how can we prevent constipation by avoiding all this. So firstly, let's talk about lack of fiber in your diet. So there are two types of fiber. One is soluble and other one is insoluble. Soluble fiber helps you regulate your blood glucose levels, whereas insoluble fiber adds bulk to your stool. It is very important to add bulk to your stool because it adds volume so that your stool can pass easily every morning. But when there is lack of insoluble fiber in your diet, that is not the case, and you are not able to get freshen up every morning or each and every day. Now when you know what is the role of insoluble fiber, let's understand what are the sources of achieving it. You can include whole grain cereals in your diet. Whole grain complex carbohydrates help you increase the fiber intake. Secondly, whole pulses just like rajma, soybean, lobia or whole moong can help you increase your fiber intake. Include at least 4 to 5 doses of fruits and vegetables in your diet each and every day, and make sure you're eating fruits with skin because skin has most of the fiber. Another benefit of fiber is it won't add any calories to your diet, but it will keep you fuller for longer, so you won't overeat as well. Now when we know what is the role of fiber, let's talk about what is the role of lubricants. Lubricants such as desi ghee, oils actually help provide a smooth movement of your bowel through your intestine, and you are able to pass your stool easily through your anus. When you are on a no fat diet or a very restrictive diet where you're not allowed to eat any oils or desi ghee or any form of lubricants, then your endometrial lining of your intestines become dry and you're not able to pass the stool very easily. So make sure, even if you are on a weight loss journey, you are including at least 2 to 3 spoons of desi ghee, 2 to 3 teaspoons of desi ghee each and every day in your diet. Apart from that, do include mustard oil or coconut oil, whichever is known to your area. Let's talk about the third issue, that is lack of water intake. So whenever you're digesting your food, all the water from your food is being absorbed in your large intestine. So you need additional water to make sure that your stool is soft, because since all the water from the food is being absorbed by your large intestine, your stool hardens, and to soften that we need water. If your stool is very hard, it would be very difficult and painful to pass through. So make sure you're including 4 to 5 liters of water each and every day if you are constipated. Let's talk about the next source of constipation, that is your peripheral muscles are stiff. Peripheral muscles are located in your mid back, and when the peripheral muscles are stiff, you have slight heaviness and pain in your back. When they are stiff, you are tend to get constipated because peripheral muscles are responsible for contraction and relaxation of small and large intestine. If your peripheral muscles are stiff, it won't let your intestine contract. So I will just upload a diagram of large intestine, and you can see it's going upwards. So to move your stool upwards, it is very important for it to contract and relax. But if it's not contracting and relaxing, your stool is not going to pass through. So when your peripheral muscles are stiff, this movement is not happening. How can you prevent it? You can prevent it by some simple stretching exercises that you can do at your home itself. Include a good stretching exercises for your intestines. Make sure you're doing 4 to 5 times a day if you are severely constipated, and these stretching exercises can definitely help you reduce your chronic constipation. Make sure you don't stop onto all these things once your constipation is cured, because it will come back, because constipation is not a disease, it's a lifestyle disorder. If your lifestyle is not proper, it will definitely come back, just like PCOS.